Hello, everybody. Wherever you are joining us from, good morning, good day, and good evening. Thank you to those who are joining us live and also to those listening in afterwards. I would like to warmly welcome our guest today, who I'll introduce in due course. For those of you who don't know, my name is Catherine Duggan. I'm the Chief Executive Officer at the International Pharmaceutical Federation. I'm responsible for delivering the FIP vision and strategy, and our vision is for a world where everyone benefits from access to safe, effective, quality and affordable medicines and health technologies. The FIP mission is to support global health by enabling the advancement of pharmaceutical practice, sciences and education. And this programme is part of the delivery of the vision and the mission. We are pleased to be delivering the event entitled Reviewing the FIP Transforming Vaccination Programme, Enabling and Supporting Our Profession. Welcome. So before we start, some housekeeping announcements, which many of you will be familiar with by now. You will all know this webinar is being recorded and live streamed via Facebook. The recording will be freely available on our website at www.fip.org. And we would encourage you all to ask questions using the question and answer box provided, and we'll come to those throughout the session, potentially taking them at different time points if time allows us. You're welcome to provide feedback to us on what we've done well and what we could improve at webinars@fip.org. And also we would encourage all of you to become a member of FIP at fip.org/membership registration. Fabulous. So we have a super exciting event today. We have a set of panelists who have been chairing the 6 events prior to today, establishing the needs we have in our profession across science, practice, education and workforce. But before we move to them, I would like to welcome my co-chair today, known to all of you, President Dominique Jourdain. Dominique will be providing us reflections and context for the delivery of the vision. Next slide, please. Dominique, over to you.
Thank you, Catherine. Hello, everybody. It's my pleasure to be part of this event today, the 8th episode of the Series 1. And I'm very passionate about vaccination because I am convinced that this service is very important for pharmacists and very important for our patient. What I want to tell you today is we have 2 very important point in FIP since 2 years. It's the one FIP strategy, one side, and the other side is the COVID-19 pandemic. When I take the COVID-19 pandemic, it shows us how important all the 3 domains of pharmacy are very important for the development of our profession. FIP is unique because we have the science, practice and education under one roof. And the COVID-19 has shown how important the 3 domains are. When I see all the pharmacists working in a team for discovering new vaccines or treatments for COVID-19, and education is the first step to allow the pharmacist in the practice to be very efficient and to assure the safety of the patient. So that this COVID-19 pandemic shows how crucial the role of pharmacists is for our communities. And one of the important things who can save life is vaccination. Prevention is one of the bubble that we underline in our new FIP strategy, and Catherine will develop the strategy later on. But this prevention tool called vaccination is very important. And my concern will be that all over the world, the pharmacists will be able or allowed to vaccinate because first, the pharmacies are very convenient for our people, and we are complementary as a pharmacist to doctors. So no competition between doctors and pharmacists, but complementarity, and this is what we need in the future for our population and communities. The second thing I want to describe is a one FIP strategy. In a one FIP strategy, it's not a dream, but it's a reality that all the pharmacies should be unified under one vision, one mission, and one strategy. What we tried to do, and this kind of a meeting today show that it's quite successful, is to break down the silos between science, practice, and education, so that all together will give in the future a pharmacist who is competent, who is useful for our communities. And this is also FIP as a platform, give the support for all the member organizations and all the pharmacists over the world to allow our profession to develop new services for our communities, for our population. And one of this new service should be vaccination. We will hear also how important the safe and valuable vaccines are for the population, and how vaccines can save millions of lives all over the world, and especially for low and middle income countries. It's important that the pharmacists would have this role to help so many people who needs a new vaccine or need to be vaccinated. And the last thing I will say is that FIP is an important organization that can help and support our member organization all over the world to move forward our profession, bringing together as a platform member organization which skills to member organization who have some needs. And this role of FIP will be important in the future, because we don't have time to waste, and we have to move forward very quickly to be recognized as pharmacists, having a crucial role in our health systems, by the governments, by the population. And this is my wish, that the support of FIP will be successful, and as soon as possible, in this case of vaccination, that all the pharmacists all over the world will be able to vaccinate and have the right authorization to vaccinate the population. So thank you very much to be with us today. I wish you a very fruitful session, and I go back to Catherine for moving forward. Thank you.
Thank you so much, Dominique, putting it together nicely for us there. So, colleagues, transforming vaccination regionally and globally is the first FIP transformation outcome-based entire programme of its kind. It's underpinned by the FIP Development Goals, and they form the part of the next series. We'll be touching base on them throughout. The final outcome of the programme will be a historical global commitment to action on vaccination and pharmacy. And you've heard our president articulating the vision for pharmacy, that pharmacists will be involved in vaccination in all ways and shapes and forms across all our nations. So this is our ambition. And we will be publishing the FIP Transforming Vaccination Collection 2021 early next year. Next slide, please. So, colleagues, please, we urge you to engage with us and help us answer those questions that I put up on the screen there. Type your answers in the chat box, and these will steer our further conversations and discussions during the next series and beyond. And also, don't feel that this is the last time you can engage with us. We'd be very happy for you to send us your ideas and your opinions. So, what single factor should be prioritised to transform pharmacy vaccination services globally and regionally? And in your view, what would be the most important achievement in terms of pharmacy vaccination services in your country in the next 5 years? Let's keep it local. And what else should the FIP commitment to action outline? All of these things we will seek to come back to through this session, but also beyond. Thanks so much. Next slide, please. So coming to today's episode, transforming vaccination with the FIP DGs, bringing science, practice and workforce together. We plan to have a roundtable session that examines the issues from all of the series so far. Today, our panelists will provide us with their key insights from each of the episodes that they were involved in and the suggested path forward to achieve transformation of vaccination globally and regionally. And we will ensure all of these feed into Series 2, into Series 3, into our commitment, and into the collection that I mentioned earlier. One of the main outcomes for today, we know, is to define and quantify changes to existing undergraduate courses, for example, to ensure that newly graduating pharmacists are ready to deliver vaccinations. But there will be many other key points and priorities emerging. So, thanks to remind you of where we are in our programme. This series is running from last month to the end of the year. Series 1 has focused on identifying the needs of the pharmacist and the pharmaceutical scientist workforce to deliver on vaccination transformation. Our next series, which starts next week, will discuss the actions required to deliver on the needs identified in Series 1, but through the lens of the FIP Development Goals. And our final series will focus on member organisations across the 6 WHO regions and how they have addressed or plan to address these actions. We won't just be focusing on colleagues who can vaccinate, but those who have experience where they are finding that a struggle and how they can contribute to their public health. So let me just take you through a summary of the series. As I mentioned, this is the first of 3 series. This is the 8th episode, focusing on identifying the needs for vaccine transformation across the 3 domains of our organisation. Vaccine transformation will be delivered through workforce enablement, addressing anti-science and misinformation, addressing vaccine hesitancy and incorporating vaccine qualifications into our workforce education programmes, both at the undergraduate level, but also continuing development as we need to support the existing workforce and ensure all pharmacists in all settings are capable and supported to deliver vaccinations as a standard part of their practice, so it becomes usual practice and builds on how pharmacists are seen during the COVID crisis as the gateway to transformative healthcare. What we've done in this series is to identify the needs of pharmacists and the pharmaceutical science workforce. We have one main outcome, as I mentioned, which is the undergraduate, but we have many more to follow, and that's where this session will build. On this slide, we can see that we've had, to date, not counting today, 1,000 colleagues engaging with us live and 10,000 more engaging with us after the event through the downloads of the events. We look forward to those numbers growing. Next slide, please. A very quick overview for you of the different regions that our colleagues have engaged from: Eastern Mediterranean, Europe, Southeast Asia, Western Pacific, and the Americas. And of course, we will be engaging with each region very purposefully in our Series 3 and as soon as we can. And of course, we have delivered sessions with our global partners, PharmaPod as one example, IPSF as a fundamental example too. Next slide also shows us the engagement from the AIM colleagues and countries thus far. So if we take a step back, remember a few weeks ago, 25th of September, World Pharmacist Day. It was the last day of the FIP Virtual Congress, and we featured a round table of guest panelists who were interviewed to get their insights into the priority areas for vaccination transformation. There we discussed the aims, the impact of COVID-19, and we explored the main aims of the programme, really set the scene. In episode 1, our guest panelists were asked to address the changes needed and essentially to take us forward on the journey throughout the rest of the series. Next slide, please. What's really important, colleagues, is for us to remember not only what we presented on World Pharmacist Day, but even the advances since. So just to remind you from the first episode, this slide summarises the main global agendas, demonstrating the vaccines are critical to the prevention and control of many communicable diseases. Therefore, vaccines underpin the global health security we all need in our societies. Vaccines are critical for addressing emerging infectious diseases, for example, by containing or limiting outbreaks or combating the spread of antimicrobial resistance. And that week we saw the launch of the AMR Commission, and I'm pleased to say that calls for that commission for applications will be going out this week. Vaccines will help keep an estimated 24 million people from falling into poverty by 2030. And we want a world where everyone, everywhere, at every age, fully benefits from vaccines for good health and well-being. We also note that immunisation is linked to 14 of the 17 Sustainable Development Goals. So, if we were in any doubt before this series that vaccines and vaccination was important, we now know there is no way we can ignore this. Now it's time for us to hear from Tedros from the WHO.
Vaccines are among the most powerful innovations in the history of humankind. Up to 3 million lives are saved every year thanks to safe and effective vaccines. But there are still millions of children worldwide who don't receive these life-saving tools. Many have never been immunized. We must not tolerate a world in which a child dies from a disease that can be easily prevented with a low-cost vaccine. Immunization is a building block of strong primary health care and universal health coverage. Increasing vaccine coverage in low and middle income countries by 2030 would not only save lives, it could also prevent 24 million people from falling into poverty due to health expenses. Immunization is also vital to achieving the Sustainable Development Goals, even those not directly related to health. Vaccines allow people to live full, healthy, and productive lives.
Super important messages there from Dr. Tedros. I think we're all aware of them, but it's important that we bring them to the forefront during this session. Now, you'll remember that I mentioned that vaccines will keep an estimated 24 million people from falling into poverty over the next decade. And we know that immunisation is linked to 14 of the 17 Sustainable Development Goals. This slide clearly outlines which FIP DGs are linked to pharmacy-based vaccination and vaccine-related services. 17 of the 21 FIP Development Goals are linked with a central role in some of them, such as FIP DG 10, equity in access to vaccination services across all ages. FIP DG 11, impact and outcomes, and not only in terms of disease burden, but healthy living, and also economic outcomes, education and social gains. FIP DG 15, people-centred care, namely by providing more convenient and accessible vaccination services in our communities. Exactly what we need and where we need our pharmacists. FIP DG 16, communicable diseases, the most overtly linked one, of course, but let's not forget how vaccination is so central for the management of non-communicable diseases as well. FIP DG 17, I mentioned previously antimicrobial resistance, and antimicrobial stewardship is one of the ways that unite science practice and workforce underneath the banner of removing resistance, but also managing the antimicrobials we have. And vaccines are absolutely central in strategies to curb this. FIP DG 18, improved access to medicines, devices and services. Never before have we seen such an important, prominent role as in COVID-19 for this. So we shouldn't lose sight of this as being a prominent goal. And last but by no means least, FIP DG 19, which is patient safety. It's such an important element in vaccine development and delivery. As we know, we need vaccines to be safe as well as available and accessible. Next slide. So vaccine, again, will help in an estimated 24 million in a world where everyone, everywhere, at every stage fully benefits from vaccines for good health and well-being. We fully support and endorse the need for life course vaccination. The following two short videos illustrate that point from both ends of the life course. Thank you.
Our lives have been turned upside down by COVID-19. When a vaccine becomes available, it's critical that all of us get it. What we do as individuals will impact everyone's health, including those who can't get the vaccine. We won't get through this unless everyone takes part. Now is the time to get up to date on all recommended vaccines for both kids and adults. Experts say it's more important than ever for everyone to get their flu vaccine this year. And if you're older, you should get both the flu and pneumonia vaccines, since both illnesses can make COVID-19 even worse. Vaccines are available at a lot of convenient places, so be an example for friends and loved ones and encourage them to get vaccinated too. We all want to reunite, travel, and get back to school and work. But that means we all need to get on board. This is the time to do what's right for each other. Get vaccinated. It's our best shot.
So, colleagues, we absolutely emphasise the fact that FIP supports life course vaccination. And you will remember that on World Pharmacist Day, which was the 25th of September, at the first event of this programme, we launched the FIP call to action to expand the role of community pharmacies and the workforce in community pharmacies in vaccination, including against COVID-19 and other future pandemics. I just wanted to note, colleagues, that it was World Pharmacy Technician Day yesterday, and that all our work will be supporting patients' access to vaccines through all of our workforce. So now to our review. Second and third episodes focused on practice, colleagues. Episode 2 was transforming practice and focus on strategy and policy for global change. At that episode, panelists representing member organisations discussed their success in advocating for pharmacist vaccinations regionally, from policy development, strategic implementation, regulatory reform, and identifying and addressing practice needs. They also discussed the work that still needs to be done around the barriers that need to be removed and the enablers required to deliver the promise of transforming vaccination, really what Dominique has mentioned in his opening remarks. The next slide shows episode 3, and here it was entitled Enabling Practice, Empowering Pharmacists and Removing Barriers. The panelists with expertise in workforce upskilling discussed the barriers to pharmacists delivering transformation of vaccination, the access for facilities that are needed in practice to deliver vaccination, the regulatory barriers to vaccination by pharmacists, and also addressing stakeholder resistance to change, which we know affects all of us in all of our countries. This episode outlined the process of getting pharmacists from the now of current practice to the vision of pharmacist practice will deliver commitment to transforming vaccinations. Discussion considered the practice needs of all pharmacists in all settings, insights from operational levels, also where they haven't been offered before, understanding what good pharmacist vaccination practice looks like, and considerations of space utilisation, storage, and logistics to support pharmacist vaccinators, all of which make it reality. Next slide, please. So, it's my pleasure to introduce the moderators of 1.2 and 1.3 in this series. And before I hand over to Emma and Paul for their reflections, I just want to say a couple of introductory words. Now, Emma Paulino is known to many of you. Emma is a practicing pharmacist at her own community pharmacy in Portugal, but she is the FIP professional secretary. She is general manager of FIP, a company that engages community pharmacists and pharmacies in the implementation of patient support programs. She's a member of the National Board of the Portuguese Pharmaceutical Society, represents our organisation at a variety of international groups and meetings, such as the PGEU in Europe and ANF work as well. She's a member of our bureau. She's fundamental to all of the work we do on practice, but her role spans education and science too. And she's previously been chairperson and project coordinator of the Young Pharmacist Group, a member of the FIP Programme Committee and secretary of the Community Pharmacy Section. She's also president of the Pharmaceutical Care Network in Europe. Welcome, Emma. Next is Paul. Paul is an experienced community pharmacist and pharmacy owner living and practicing in Sydney, Australia. He is the current chairman of the FIP Board of Pharmaceutical Practice, we call it BPP, and he's immediate past president of the FIP Community Pharmacy section. Paul is a current elected member of the Pharmacy Council of New South Wales, the professional regulator. He's had a long-term involvement with the Pharmacy Guild of Australia, being a past president of the New South Wales branch and a past national vice president. And I think it's with great pleasure that I would welcome Emma and Paul to provide us with their reflections. I wonder if we could go to Paul first with the next slide. Welcome.
Thank you, Catherine. And good morning or good afternoon and good evening, everyone. And thank you for joining us today. Well, these two episodes certainly captured some varying practice settings and some great learnings, I think, for all pharmacists. It was based around identifying transformative needs, in particular focused on strategy and policy for global change. And it's important to note, I think, that each of the presenters were from a different practice setting, different regulations, and at a different point in the journey along the vaccination pathway. It's important, I think, to say that there isn't a one-size-fits-all solution here. Ultimately, different marketplaces, different jurisdictions will require to some degree a bespoke solution. But in getting that bespoke solution, there are learnings from all of the countries involved, and hopefully we can identify some of those tonight. The next slide, please. Okay, so we had 5 presenters from Singapore, Pakistan, India, Lithuania, and Jordan. Vastly different marketplaces, all with some common issues and some peculiar to particular countries. We started off with a presentation from Yong Pei Ching from Singapore, where the government controls most of the distribution of medicines, and there is a small private pharmacy sector there with 160 pharmacies. The issues that arose there were, and this is common to a lot of jurisdictions, inconsistencies in vaccination documentation, access to the vaccination record, and also difficulties within the workplace, within the community pharmacy infrastructure to accommodate a professional service delivery. Advocacy there is strong via social media, and they have a very active pharmacy network there. But they are in an environment where flu vaccine, for instance, is prescription only, which can be an issue and in fact a barrier itself. Faraz Ashraf presented to us from Pakistan, where there isn't any direct legislative support for pharmacists to vaccinate, but pharmacists are viewed as educators, facilitators, and in some provinces, it is within the jurisdiction, within the scope of practice rather, of pharmacists to vaccinate. Pharmacists are slowly being integrated into primary healthcare facilities within Pakistan. Again, there's an issue with the shared patient record, but they are certainly optimistic that as pharmacists become more integrated, opportunities will arise, and that advocacy has started. Next slide, please. Thank you. Our next presenter was Manjiri Garrett, a FIP Bureau member from Mumbai in India. And India, just by its scale, is different. There are 1.3 billion people, and there are over 700,000 pharmacists in India. So the scale of providing any service on a coordinated manner, the challenge there is enormous. Other issues associated with pharmacy in India, excessive workload, a shortage of staff, lack of training and lack of legislative support for vaccination. However, there is the IPA is a very strong pharmacist organisation, and there are moves afoot to start that advocacy, and they view the COVID situation at the moment as an enormous opportunity if a workforce can be trained to deliver a vaccine in the future. Indra Trakoinian gave us a very interesting presentation from Lithuania. And perhaps the standout comment from all of the vaccination webinars that I heard was that in Lithuania, pharmacists are viewed as healthcare professionals, but not as healthcare providers. And they certainly view the opportunity to offer vaccinations as a way to change the public perception and the reality of pharmacists not only being viewed as healthcare professionals, but as healthcare providers. Again, there is an issue with access to healthcare records and finding a key player and opinion leaders or a champion to advocate for this service to be provided via pharmacy. Jordan's a successful vaccination story, and they've succeeded in having pharmacist vaccination approved and delivered via community pharmacy. The Jordanian Pharmacy Association, which is headed up by Samira Shamas, or heavily involved is Samira, has been instrumental in delivering this initiative in Jordan. The key factor here was that the discussion started with the ministry and the policy bureaucrats very early in the piece, and they need to be part of the journey. If you don't have them on board and advocating with you and for you, it is very, very difficult. The local Pharmacist Association was very proactive in developing guidelines and immunisation training modules, which are seen in some places as being a barrier to implementation. They did originally identify a loophole in existing legislation which opened the door, so to speak, to providing this service. So varied practices, varied setups, and all these countries at different stages of the journey. Could I have the next slide, please? So the needs identified. FIP can help in the advocacy process because this will not happen without strong advocacy from member organisations. Generally speaking, webinar participants are looking to other countries to help with training resources and infrastructure requirements. Again, there will be an opportunity, we would hope, via FIP to access those training resources through a provider platform, and also to advocate with the legislators for infrastructure requirements within community pharmacy. What was obvious was that a stepwise approach is imperative. It should be based on member organisation experience towards the advocacy and the legislative process. There is an opportunity for support by the FIP Vaccination Toolkit, which was recently launched, as one of a number of advocacy tools that FIP has. In terms of barriers and facilitators, there seemed to be a common story of barriers being access to vaccination records, either paper or electronic. Education is perceived as a barrier, yet it is the ultimate enabler for pharmacists. Remuneration and in-pharmacy infrastructure were also identified. Facilitators were certainly around community pharmacy access, a community need, and also an available workforce that exists within community pharmacy. Next slide, please. So in summary, the starting of the journey for some seems overwhelming, but a couple of things that will make it an easier passage. Small steps. Every journey starts, the longest journey starts with the first step. And it's best to take that approach and also a trial. If you can show proof of concept, you're in a much stronger position to then advocate for broader implementation of that service. And to utilise member organisations for advocacy and to look to FIP for access to resources to help you in that. Thank you, Emma.
Hello, everyone. Good morning, good evening, good afternoon. I hope you are all doing well. And for my part, I will cover event 1.3, which is the event which is the event where we dealt with health economic considerations. And I have to again thank Paul for co-sharing this session with me, and also all participants, and obviously also our speakers who did a marvelous job in talking about the health economic considerations that have to be taken into account when not only when we are establishing the service, but also when we aim to provide this service in a sustainable way. We also talked about experiences of pharmacists in earlier pandemics and how we can use that experience to feed on the vaccination model we want to provide, and also the technical requirements of vaccination delivery. For this, we had speakers from Egypt, UK, and Costa Rica, which provided valuable insights. And then we had the opportunity to answer some of the questions, which were all very important also to enrich the debate. Next slide, please. So, when we were asked to identify some primary takeaway messages, obviously what we ended up discussing and acknowledging is that health economic considerations are very important. Cost benefits of pharmacist vaccination obviously are useful to advocate for an expanded role by pharmacists. And of course, also on the other side, remuneration is critical to program sustainability. And there are different models. We have places where patients are paying out of pocket. We have others where national healthcare systems are covering the costs. And we also have models in which we have insurance companies covering the cost of the vaccination and the cost of providing the service. But of course, it's always important to identify potential payers and advocate for the role as something that is cost effective for the payer in this context. We also considered funding based on outcomes. So it is important to establish the value for the service and the outcomes delivered, and based on that information then put forward a proposal for the remuneration of the service. Next slide, please. So we also discussed how can we achieve this, and there were some comments about how we can move forward to achieve this goal. Some of what our speakers advised was that we should start with a small manageable trial where we can evaluate the outcomes of that trial, both in terms and outcomes in terms of vaccination coverage, but also the cost effectiveness of the service itself. And then based on the results, have more advocacy actions that will enable the service to be disseminated and implemented in a wider area, region, or for a higher number of pharmacists. Fourth, we also discussed the importance of establishing a suitable legal and technical framework. And for this, we mentioned and we also presented, and particularly Elena, who was from the UK, who was involved also in the production of some FIP instruments and reports. She presented the FIP toolkit, which is actually a toolkit which already exists that provides support to gather information that is critical for implementation. Also, one final takeaway message: pharmacists must obviously create a credible service and a service that must be at least as good as the services already provided by other healthcare providers who are also vaccinating the population. Next slide, please. So as for the needs identified, many of the participants wanted assistance in the definition of a structure for approach by a member organization to start the journey. So how can we start this process? And once we start, which are the steps that we have to excuse me, undertake? And for this, sharing successful examples was one of the most I'm sorry one of the most significant needs that were expressed. We had a lot of interest from countries who do not have the service implemented, who wanted more information about countries where we already have the service implemented, to understand which were the steps, and also to be able to use and adapt the toolkits and the information, the training structures, etc., that were utilized. So definitely a network platform to share successful examples would be one of the important outcomes of this effort. Next slide, please. And finally, in terms of the advocacy and the trial and the evaluation, obviously we consider this to be a cycle, so further advocacy is always needed, and so it's important that the service is monitored and produces outcomes that can then continuously be used to advocate for increased scope and increased implementation. And finally, health economic considerations are critical. Like I said in the beginning, these can drive the start of the process and will for sure ensure its sustainability. And that's it from me. Thank you so much for having me in this very important endeavor.
Well, thank you so much, Emma. And thanks, Paul. Well, I wonder if you could come back to us, because I'm just going to ask you both a question each, give you time to catch your breath there, Emma. Before I go to our science events, I think it would be really useful to build on your reflections. Paul, you said that barriers were little access to patient records, education and remuneration. But if I was to ask you, what would you say the most important one of these faced by our member organisations would be, so that we can prioritise those in BPP and more widely across FIP?
Thank you, Catherine. Well, electronic records are really part of a national infrastructure. So we can advocate for those, but we can't fix that. What we can do is direct practice within our community pharmacies to accommodate at the highest level provision of professional services. So that if we are going to be credible providers, we need to start thinking about having a professional services room within our pharmacy where vaccinations can be delivered, where cholesterol testing can be done, where any number of professional services can be delivered to our patients in a credible and highly professional environment. So certainly to try and advocate for a vaccination service without suitable infrastructure within our pharmacies is a false hope. So that we have to make the commitment. It does involve a capital commitment, but that is about changing the way we practice and expanding our scope of practice. So infrastructure within our pharmacies, absolutely critical and something we can all be part of.
Fabulous. Thank you, Paul, so much. And I think I'm taking away from there is that perhaps some kind of practical toolkits about how to set this up, no matter where this service would be, that addresses the points you've made, could be a priority for us as an organisation. That's super helpful. Thanks, Paul, so much. Emma, as professional secretary for our federation, what priority do you see practice needing to take hold of in light of the pandemic? So much has changed in the pandemic. What one thing would you think would be our key leverage for transforming the role we would have in vaccination?
Well, I definitely think that it is increasingly important to have the pharmacists sitting at the table. And we've seen that throughout this pandemic, that because we are mostly pharmacists working in private practice, so community pharmacies, although they are considered part of the healthcare systems, they are not usually officially part of the primary healthcare team. And in the beginning of the pandemics, I think that we were all facing some communication issues about, and that was due to the lack of the pharmacists present at the table discussing how community pharmacy and community pharmacists could participate in this effort, and even hospital pharmacists, because they are in a smaller number than other healthcare professionals in hospitals. So I think that now we are being acknowledged as an important gateway to care, and not only a gateway, but now we have to have an open door and fix the issues. So we have seen a number of countries where the potential role of the community pharmacists and the pharmacists in general is being taken into account in terms of what will happen in the future for COVID-19 vaccination and treatment. And we are seeing pharmacists being involved in the strategy for addressing this pandemic, not only in terms of what happens with the COVID-19 patients, but also with the non-COVID-19 patients who are facing difficulties in accessing healthcare services. So I think that we will, I think that this has been a huge opportunity to place pharmacists as truly a member of the healthcare team, no matter where we practice, public, private or social sectors. And I think that that is being achieved, but we have to ensure that the pharmacist is at the table to discuss these issues. And I know that FIP is working to be at the table with WHO, discussing this at the global level. And I think that it is important that we assist member organizations in also sitting at the table at the national or regional level to discuss these issues and to affirm the pharmacists as part of the solution.
Great. So Emma, we have almost like the mirror toolkit, really. It's about very practical advocacy that people can use locally as well as nationally, and use this moment, this terrible moment, this terrible year we're in, but use it to good effect to ensure we're at that table. Thank you so much. Thanks, Emma, and thank you, Paul. We hope that there will be time, but we've a lot to cram in now. So I just wanted to avail of the opportunity while I had you as captive audiences before we move on to the next slide. Thanks both. We'll pull you back in if we have time later. Next slide, please. So the next pairings of episodes in our series 1 was around the science needs we have. Episode 4, addressing barriers to uptake, adherence, misinformation and anti-science. The panelists with expertise here within pharmaceutical sciences discussed the science of vaccinations, these new developments in vaccination delivery, the state of the COVID vaccine research, almost like a bit of a state of the nation event there. Medicine's adherence with a focus on vaccine hesitancy and the impact of misinformation and anti-science, which we know is a reality in 2020. And here we had Ross McKinnon, I'll introduce Ross a little bit later, interview Colin Poulton and Nikolai Petrovsky, which was a great interview. I would urge you all to watch that if you can. Next slide, please. Episode 5, built on the same format, from smallpox to COVID-19 vaccine development and innovation. Panelists here with expertise in sciences focused on the history and the future of vaccination, how vaccines are developed, the difficulties in developing vaccines for emerging diseases, as we're finding right now, and the impact this has on our ability to deliver population-based vaccinations in a timely manner. Here, the panelists discussed current research and where this is heading in the near future, recent developments in vaccine production and logistics, and how COVID has impacted vaccine delivery, also collaboration. So, you know, it was a positive session. Next slide, please. So I just wanted to spend a moment to introduce moderators of session 4 and 5, and then I'll hand over to Giovanni, who'll provide us with some reflections. Ross McKinnon is the current chair of the Board of Pharmaceutical Sciences at FIP. He took up his position last month, and prior to this, he was a former vice president of our federation. He is currently the Beat Cancer Professional Chair at the College of Medicine and Public Health. He was previously Foundation Director of the Flinders Health and Medical Research Institute and Dean of Research. A former Flinders School of Medicine PhD graduate, he joined Flinders as Director of the Centre for Innovation in Cancer in 2011 after 16 years with the University of South Australia, stepping down from this role in 2018. He's an academic, he's a pharmacist, he has a broad research interest in pharmacology, pharmaceutical biotechnology, and molecular oncology areas. He's a co-inventor of patents relating to cancer, chemoprevention through PharmaQuest, and the discovery of novel anti-inflammatory compounds. He's a board member of the Therapeutic Innovation in Australia. And Giovanni Paoletti, known to many of you, is the FIP Scientific Secretary since 2015. He provides our Federation with leadership for scientific aspects relevant to pharmaceutical sciences, the practice, and our education. He is Associate Dean for Graduate Studies and Pfeiffer Endowed Chair of Pharmaceutical and Administrative Sciences at the University of Health Sciences and Pharmacy in St. Louis in the US. And since 2015, he has served our federation. He received his pharmacy and PhD degrees from the Swiss Federal Institute of Technology in Zurich in Switzerland. He directs an interdisciplinary research program focusing on novel drug discovery systems. He's published more than 160 scientific papers and is an inventor on 9 US patents. Giovanni, I understand, because Ross can't be with us today at this session, you'll be presenting back the findings and reflections from both our science-based events, which I thoroughly enjoyed. Over to you, Giovanni.
Thanks so much, Catherine. And it's a great pleasure to fill in also for Ross McKinnon, who is unable to join us today. So he had some very interesting discussions with Nikolai Petrovsky as well as Colin Poughton about the scientific aspects underlining and governing vaccine development. And what's novel for today is certainly that these activities are now front and center across the world, because everyone is looking forward to find a new vaccine against COVID-19. It was discussed that we currently use multiple platforms for the vaccine development, and that includes certainly the ones that we have been using for many decades, and most of them are protein-based, and also some new ones and unproven technologies, which are the gene-based vaccine development platforms. And because those are complex materials, quality standards associating with the development of those materials, either through manufacturing as well as distribution systems, are quite different. And I can come back to that when I comment on the interview I had with Ron Gary-Chancy from the United States Pharmacopoeia. It was highlighted by Nikolai that the timeline for the development is unprecedented because of the demand for COVID-19 vaccines. So there is a lot of activities in the vaccine development, multiple trials at the same time. And as a consequence, we hope to achieve the development of this new vaccine in record time. We also need to be aware, because of the large number of different approaches that we have taken, that many of those will fail. And this is an aspect that I think the scientific community needs to learn from in order to be able to develop more effective pathways in the future. The vaccine development for COVID-19 was initiated quite rapidly after the discovery of the genetic sequence. And that probably has brought us ahead of the normal vaccine development cycle, and brought us to a stage where I think we can be quite confident that at least one of these trials will be successful, because we have multiple trials on the way, as we know, probably about 40 at the time, and they're at different stages, and hopefully they will all give us some scientific learnings, and at least one will give us a vaccine that provides an immune response that lasts for a while. I think major factors in this race for a vaccine, because of the accelerated pathway, certainly the financial risk. There's a lot of investment that's necessary in order to accomplish these trials, involvement of patients and subjects that need to be monitored adequately. The data need to be analyzed. So everything is done in record time using all the resources available, and that's costly. And that's certainly something we have to be aware of, because we don't want to compromise the safety of those trials. In addition, it was highlighted that we certainly need to look at some questions that we haven't addressed yet, and that is with regards to the dosing schedule of those vaccines, also there are multiple collaborations between companies, and licensing pathway haven't really been worked out, and whether or not we can produce these vaccines at the scale that we really need in order to get a quick vaccination across the globe. Next slide, please. So overall, we're very optimistic that this development process is proceeding at the record time. And we have utilized and also learned during this process to utilize novel platforms for the vaccine development. I think it is pretty sure that we need adequate funding in order to be successful. And a lot of people are working on that across different country lines, and also WHO is supporting this effort by providing some consortium across their political scale. And we hope that we can then align the production of these vaccines to a scale that allows us to roll it out very quickly across the globe. I think what's important, and we have discovered that in the recent months across different jurisdictions, is that we need to assure that the scientific information is driving some of the political decisions in various countries, because if we cannot rely on science anymore, then it becomes very difficult to keep the trust in the population on these pharmaceutical products that hopefully provide us with the protection from this and future infectious diseases. Next slide, please. So I had the chance to interview Ron Pierre Vicenzi from the United States Pharmacopoeia, and this organization has been developing quality standards for many different small molecule drugs as well as biologics. And it was important to highlight that the performance standards for biologics are quite different than for small molecular drugs, because it's not only a simple yes or no that it complies with something, because these materials are quite complex. And quality standards need to be developed from manufacturing, but also throughout the distribution chain, because some of these vaccines can be quite sensitive to the environment, and in addition are usually injectables or parenteral formulations. Associated with quality standards for manufacturing and distribution is the need for appropriate development of analytical method to measure whether those materials comply with the quality standards. And because vaccines are not static, they change. Let's say the flu vaccines, it needs adaptation of these methods over the years, and that adds additional time as well as resources in order to accomplish that. We also have to understand that some of these vaccines are quite complex biological materials, and so they cannot be manufactured to one single standard, but we need to accept certain variability due to the complex composition. We discussed in our interview with Ron also the vulnerability of pharmaceutical supply chain that has been highlighted by some of the activities in various countries, because we have become dependent not only from the manufacturing, but also from the distribution channels from single countries. And while we have a good understanding of where manufacturing occurs, we certainly need to learn a lot more on how the global supply chains up to the final patient or subject that receives the formulation is structured. And the USP has collected a lot of information in the recent time, and hopefully we can learn from that. Focus will be on the supply after manufacturing. So we have certainly a big role for pharmacists there to play to make sure that we have the integrity of the supply chain is maintained, and patients really receive the high quality material that has been produced. Next slide, please. So in a summary, the vaccines are not simple molecules, they're chemically complex, and as a consequence of that, we have to constantly assure that we work with the most effective composition of these materials in order to achieve the immunity across the population. I think what's relevant with regards to the COVID-19 vaccine development, it is relevant for us to have access to scientific information, even for those trials that actually fail, so we can learn and move the scientific process faster. And key change is, how do we deal with that in the future if multiple companies and entities are actually working together on the development of vaccines, and each of those activities has certain intellectual property protection aspects that need to be worked out. Thank you.
Thanks so much, Giovanni. While I have you here, I wonder, given your overview and reflections, what would be your opinion as to the priority area that FIP can help our members to develop their pharmaceutical sciences capacity to support this vaccination agenda? If there's one thing we could do, Giovanni, what would that be?
I think it's important that we try to facilitate, access to information. This is really key for everyone to understand what the scientific level of development is, and then provide the population with the appropriate information. Misinformation on scientific aspects is very damaging, as we know, because it builds mistrust in the health community as a whole, and particularly when you try to deal with the global vaccination program that will be rolled out hopefully within the next few months. We need to have assured that the information that the population gets is really accurate.
Yes, I agree. And I don't know that we would have thought that a year or so ago, but actually good, solid, trustworthy information is possibly the basis for everything. Thank you, Giovanni. Thanks so much. And thanks for those reflections. That's super good. Righty-ho, colleagues, let me move you on to the third series then. The next pair of sessions that we had just last week, actually, considered workforce and education needs. Episode 6, which is on your screens in front of you, was entitled Workforce and Education Needs Focus on Undergraduate Education, where panelists with expertise in education and workforce development discussed the integration of vaccination content into undergraduate courses, so that every graduate pharmacist is able to vaccinate from day one of practice. And of course, this absolutely builds on what Giovanni has just said and what Emma and Paul have said previously. There's a real circle here of what does practice need, what science do we need, and what education do we need to equip our workforce. Discussions at that session focused on course development and accreditation, considerations for regulations around provision of vaccinations by graduating pharmacists, and the infrastructure needed within the existing workforce to deliver the experiential context for graduating pharmacists. Next episode, last week again, episode 7, enabling our workforce, supporting ongoing competence, really was the sibling episode to this, where the first one focused on undergraduates. This session focused on the expertise in education and workforce development needed for the existing workforce. There, the panelists discussed the delivery of vaccination qualifications by pharmacists to ensure that pharmacists in all settings are able to provide vaccinations, delivering what Dominique mentioned at the very beginning of this session. The discussions were around the types of professional development available for pharmacists, practical administration skills, strategies for addressing vaccine hesitancy, again, that facts and information issue that Giovanni just mentioned, the logistics needed to support vaccine services, and any of the regulatory barriers that we find. Again, a full circle to practice. Next slide, please. So before I hand over to the moderators of session 1.6 and 1.7, I just wanted to take a couple of moments to say a few words about them. Ralph Altier is the chair of FIP Education here at FIP, the director of the UNESCO UniTwin program. We launched our decade report yesterday, and I urge you all to go and see that event. Really standing on the shoulders of giants, this report really describes great twinning of resources across Africa, and we will be learning from this. Ralph is the immediate past president of the academic pharmacy section, and he's served as a member on the AIM advisory committee as well, the AIM Galf group, and Task Force and Congress Programming Committee. He's been very busy in our federation. Ralph is also the Dean of the University of Colorado's Skaggs School of Pharmacy and Pharmaceutical Sciences in the US. Ian Bates is the Director of the FIP Workforce Development Hub, leading our international team at the Hub, appointed by FIP working in partnership with the WHO, and also Director of the FIP Global Pharmaceutical Observatory. He is also Editor-in-Chief of Pharmacy Education Journal, an international peer-reviewed research journal published by FIP. Again, another person very busy with FIP, as have all our moderators been. Ian holds the Chair of Pharmacy Education at the UCL School of Pharmacy, and he's Head of Educational Development and is a Faculty Fellow of the Royal Pharmaceutical Society and a Fellow of FIP as well. He's a trustee for the European Pharmaceutical Students Association and was awarded the RPS Charter Medal in 2017 for leadership contribution in the profession. Ralph, I'm going to hand over to you to offer us the first reflections on last week's sessions. Thank you.
Well, thank you, Catherine. It's great to be here today, joining everyone else on, I think, what is it's just an extremely important program that FIP is undertaking. And welcome to all of the participants who've joined us for this episode. So to begin with, so this is about preparing the future workforce for providing immunization services. So it's undergraduate education. And I want to start by just saying that much of what has been presented already from the practice and the science side is all involved. All of the things you've heard have to be involved in an education program. And it starts with the science and the multiple methods of development of vaccines, to the supply chains, cold storage, and all the rest of the things that we just heard about, all the practice aspects that we heard, including the physical environment that you need for providing vaccinations, educating the public regarding the vaccine hesitancy issues, and gaining, again, the trust of them and the benefits and the public health aspects of vaccination, being prepared to respond to adverse effects of vaccinations, which we hope never occur, but being prepared for having the skills necessary to respond to that, and many others. And actually, it's the actual skill of administering the vaccine, which is actually the simplest part of the entire education program. One that the students tend to be most hesitant about, but it's all the rest of the background information that they really need to have. So let's go to the next slide. We had speakers from Australia, the Philippines, and from the International Pharmaceutical Student Federation to give us the perspectives of students on this entire process. So here are some of the takeaways, at least that I came away with, and we've heard this already. Front and center is advocacy, with government regulators, having professional organizations advocate, including FIP, and importantly, getting other healthcare professionals to advocate for the role of pharmacists in providing vaccinations. So all of this is important because if you don't get approval and authorization for pharmacists to provide vaccinations, we don't have any place to go. So this was a key message that all of the speakers talked about. The other is collaborating with other countries or organizations that already have established vaccination programs, training programs. And then adapting these to your specific country needs. And again, as we heard, FIP can play a role in facilitating these collaborations or potentially developing programs. Literally everybody did this. Everybody who spoke had made these types of connections. Next slide, please. The other thing they talked about here, and I think this is important because this goes back to getting to the advocacy by other health professionals, is There's really, really good interprofessional education opportunities by collaborating, particularly with nursing and medical schools, and having the students learn together, learn each other's roles in the vaccination process, and how then they can work together when they get out into the practice environment. What I alluded to before is the training that also has to include the preparation for adverse events. So all students, certainly in my world, need to have cardiopulmonary resuscitation training or basic cardiac life support training. And again, establishing the right environment for vaccinations to occur in the pharmacy. And lastly, the student perspective is that they really desire robust vaccination training programs so that they will be prepared upon registration as a pharmacist to deliver vaccinations and provide this really important public health service. So those are the sort of the main takeaways we got from the various speakers and how they started their development of their programs. And they're at different stages, of course, in this process. Next slide, please. So, needs that were identified. Guidance or frameworks for countries that are developing these education and training programs. And this includes examples of successful advocacy efforts that are needed, not just to authorize pharmacists to provide vaccinations, but also to provide the education for students and allowing students to give vaccinations when they're on placement in experiential training. So we need advocacy at the level from the student to the practicing pharmacist. Next slide, please. I think I've already addressed the first one. So development of these training programs, again, requires this advocacy effort, but it's greatly facilitated by this collaboration with partners who already have established immunization programs. Now, why is, and of course, and we have to look at FIP and how FIP can help facilitate these collaborations through the provision program, or perhaps even providing frameworks or guidelines themselves for helping various countries' schools to begin their vaccination education programs. As I mentioned, the very broad scope of what has to be in an education program may be beyond the expertise that exists within any specific school or faculty of pharmacy. And so having these collaborations, having these partnerships with other established programs is going to be key, I think, to really accelerating the education of the future workforce for providing vaccinations. Next slide. So I think that ends what we learned from our speakers and the types of things they did to get their program started. I ended the session with a look to the future because sometimes when you're beginning down this road, it looks very daunting. It looks like it's going to take you forever. And again, because of the various areas of expertise you need, you may not have access to it within your own school. But we started on this probably about 15 years ago. And as a sort of encouragement to everyone who was in that particular episode, the next one that Ian's going to talk about, and of course, people who are participating here today. In the United States now, vaccinations of many types, flu vaccines, standard vaccinations, from the age of 3 years and up to seniors, I get my flu shot, I get my Shingrix vaccination and travel vaccinations from pharmacies. You can't find a pharmacy that does not now advertise vaccination services. You go to your primary care physician, he says, I don't do that, go to your pharmacy. And so this is what can be. This is what the future can look like. This is what success looks like. So I think that's the other message to all those who are beginning down this road is there will be success, and it will be precisely what we would like to have. So I'll end with that. And Ian, I know, is going to continue on this because it's for the vaccination services and training of the workforce that exists today. So thank you.
Thank you, Ralph. I'll take up the next few slides to talk about the workforce. So essentially post-registration or post-licensing development of our pharmaceutical workforce. Ralph is quite right. Vaccination training should be an embedded component of all initial education and training programs worldwide, and FIP will help with this. We have academic networks and experts who will help with that. But that's a long-term shift in the workforce as these new graduates, newly trained graduates, feed their way into the supply chain, into the workforce. That's a good thing. That's the foundations of the future workforce. But we do have, of course, a mature, huge workforce globally who we do need to access and reach out to in order to help with vaccination training. So the next slide shows us some of the training issues that we talked about in our session 1.8. And to summarize what's on the screen for you now, those countries who were or who are rather pathfinding their way forwards with this at national level, there was definitely a variation in how they were doing it, and in some instances what they were doing, and that relationship between regulatory bodies and mandatory training was also the variation there was also evident. And there are always different ways to do different things, and that variety can be celebrated, of course. I'll come back to that in just a moment. The next slide shows us the other summative issues that we did talk about. And I'd like to highlight WHO for one thing. WHO later this year, this calendar year, will launch a global framework, competency framework for universal health coverage. This is a major global initiative, and there has been actually quite a small team of experts who have been working on this for the last 2.5 years now, and FIP has been part of that right from the start. It's a multidisciplinary approach. It's talking about all sectors of the workforce, so from assistance, if you like, through to sometimes non-regulated care assistants, community health workers, all the way up to the regulated professions, ensuring that there is a common framework for developing healthcare competencies for UHC. We believe that vaccination training for the whole workforce can be mapped to this, and we are maybe ahead of the game because we already have a competency framework, development framework, which has looked ahead and has mapped this out already. So I think we are ahead of the game if we can enact and if we can activate this through our networks and our contacts with member organizations. So one of the key takeaway messages here is number 5, and the next slide just elaborates on that a little bit more. If we can just tap on to the next slide. We should consider a globally consented framework, a structural framework for all of our members and nations linking them with WHO universal competencies and linking them with our own professional career structures as well, using our well-established principles of adopt and adapt. So this is not about a provision model per se. This is about creating a structural framework that nations can easily adopt and then change that to suit their own local domestic needs. So my final take-home message, takeaway points here, is that we should now consider doing that and get a global consensus on this to make sure that we can continue with this hugely important program. We know we can do it together, working with our member organizations, because we've had many instances in the last few years where initiatives such as this have taken up and have worked. So this would be our key takeaway point from the workforce perspective. And in particular, I think our lower middle income member organizations would gain a vast supportive framework and a vast supportive network to help accelerate this key initiative. Thank you so much.
Thank you, Ian and Ralph. I have to say, Ralph, my question to you, you have answered really well with your final summing up. Ian, I just wonder if I could have 1 minute to ask you a little bit more to expand on the training guideline. We have lots of existing frameworks across FIP. What is the consideration you believe is key for developing such a guideline?
I think it's coming to consensus. One of the key things, I did mention variants earlier on, but actually, you know, the goals and the outcomes of vaccination training are broadly accepted. I mean, no one's going to dispute them at all. I think we need to better define the competencies that go into them, and some providers and some nations have already done fantastic work on this. Well, you know, let's get that into a structural framework so that other nations and other organizations can accelerate this and get a toolkit and a set of guidance which can be adopted and adapted.
Yes.
It's not rocket science, really. We just need to get our act together and get some global consensus and get on with it, in my view.
And I mentioned when I was talking with Paul and Emma that, you know, what would they need in practice? It seems to me, Ralph, that such a framework, to look at that from initial education as well. What are the standards? What are the learnings? What are the competencies?
Yes.
You wouldn't have to do 2 frameworks. You could do an extended framework, which helps us with some time and speediness.
I mean, the education of students and the training of pharmacists have to cover the same territory. And so you're correct. One single framework is pretty much what you need. And there exists in various regions of the world tried and true and tested programs that can form the basis of that framework. And some are member organizations of FIP. So I think the basic structure is there, the basic information is there, and it's how I think FIP can help make this accessible. And as Ian pointed out, really to low and middle income countries is key.
Prioritize. So I think this is really excellent. It's the same model, adopt and adapt across all our nations, perhaps with a higher focus on low and middle income countries to begin with, but the same model could go for practice as well as for education. Great. You know, we're developing a to-do list here.
I just want to add one other thing to re-emphasize what was said earlier is pharmacists have to be at the table when these decisions are being made at the highest levels at ministries of health. And that was another point that was made in at least my episode by people who are getting started on this. This is really key.
It is, Ralph. We've got lots of commonality, which we would have expected, colleagues, because we are all one profession, even though we've looked at this through the lens of science, practice, and workforce and education. It's very uniting to see the same common themes emerge. Fabulous. Great. Okay, I'm going to move us on because time marches on to a very important perspective to provide us with a holistic perspective of all of the needs of science, practice and education and workforce. I mean, it's super important and appropriate to seek the views of our young pharmacist group members. In this case, it's Ali Jo Shipman, the YPG liaison with the community pharmacy section. Ali is the Director of State Policy for the National Alliance of State Pharmacy Associations. In this role, she assists state pharmacy associations and associate members with understanding state policy trends and innovations. And of course, this is US, but a lot of that is transferable to wider. Ali, to really speed us along, our big question to you was, how can we engage our young pharmacists and students in the transforming vaccination agenda through practice, science and workforce? Good to you, Ajay.
Thank you. And I will be quick. I know we're getting close to our time, but most of what I have to say is just reiterating what we've heard from the other speakers and the other sessions. And really the main takeaway, I think, is don't forget about your young pharmacists and your students really as probably your greatest potentially untapped potential to really help spur this and move this along. And so when you're looking, like we just heard, about educational opportunities, so if you are in the academia space, including training in the curriculum from the start. It's always easier to just incorporate it in the curriculum, and so that also helps with students and pharmacists really just integrating that in their minds is just a standard of practice and a standard of care that they provide. So including that in the curriculum. If you can't include it in the curriculum, employer support of if you have, student interns or your young pharmacists, if they haven't received training, providing support for them to receive that training. If you can't provide it, through your means, making sure that they are able to go to conferences or events where that training is available. And so really having those educational opportunities and making sure that you push for that and you provide that opportunity for them, just to make sure that everyone, it becomes more of a standard of practice at the very beginning of their time as a pharmacist or as they're going into the field, so that they really just embody, they see vaccinations, administration and public health education around vaccinations is just part of what it means is their professional identity to be a pharmacist. And so I think that's a critical point to bring in. And next slide. And the other part I wanted to bring out was leadership opportunities. And I think this is where that untapped potential comes from. I know we were talking about barriers and barriers perhaps to implementation and things that we're working on, so that you really do see this become just a standard of practice within pharmacy around the globe, and really increasing those vaccination rates in such countries and increasing that education of patients and communities around the importance of vaccination. But when you look at your young pharmacists and your students, especially if they've received that training, include them in any planning or decision making that you might be doing, whether that is, in training opportunities or other things that you have. If you're including them in trying to incorporate vaccine services in your pharmacy or in your practice or wherever, whatever your practice setting may be, including them to help make sure they're a part of that as well. For those who are already training, putting them as project leads or coordinators. I know that a lot of us, a lot of pharmacists are busy. You're pulled in many different directions. You're trying to do several different things. If you're a pharmacy owner or a pharmacy manager or a director of pharmacy or whoever at a health system, you may not have time. You may want to implement, vaccine. You may want to really run with this project and this idea, but perhaps you don't have the time. Delegating that as, a dedicated project to a student or a young pharmacist and really giving them ownership of that so that they can both develop their leadership and management skills as well, but then also be able to take that opportunity to really contribute to their team and their profession. There's another idea And also in some instances, having that reverse mentoring. I know just from the previous discussion that we were having, in some countries, or in some situations, until it just becomes really mainstream and widespread, a lot of times your students or your young pharmacists may be the ones who have the training, who have the education, who have the knowledge and experience, and they can be used in kind of a reverse mentoring role for some of your other pharmacists who have been practicing for a longer period of time and maybe haven't received this training yet or haven't incorporated it into their practice. And it's more of a new idea for them. And so using those students and young pharmacists and remembering that there are tools and opportunities and information that they can bring to the table, I think is really, really critically important. And so I think, again, don't want to take up too much time, but just to wrap up and say, not to forget about young pharmacists and students, but also just realize that that's an easily tapped resource to really pull in to help implement and actually accomplish a lot of these initiatives and objectives.
Thank you so much, Ali, there. That was such a good summary. And I think, again, pulls together all of the needs from a perspective of someone at an early stage in your career. So thank you. Just a slide here for me to pay a big tribute to our panelists for their hard work and enthusiasm during this series, but also just such amazing colleagues for all their hard work within and across our federation. Thank you. Emma, Paul, Ross, Giovanni, Ralph and Ian. We'll come back to you a little bit later for further thank yous. So now, colleagues, that's a big summary, and this is exactly why we're going to need our FIP collection to pull together all of the pieces that you've heard from Series 1. But now let's move seamlessly into Series 2. We've established some clear and pressing needs across science, practice and workforce, and now we can review how the FIP Development Goals, each made up of the elements of science, practice, education and workforce, contribute to global health. Colleagues, I thought it would be helpful for us to really just summarise, along with concrete and tangible mechanisms. Our development goals package will include tools and structures to facilitate and process transformation in our nations and our regions. And if we do that, then we will seek and establish global transformation. Next steps for FIP around all of this programme of work and our other big priorities will be regional engagement, so that we support the development of a roadmap in each of our regions that really fit the needs of that region and the nations within it. We would also seek to set up indicators and country level metrics to develop these as a way of measuring and monitoring progress via the data we collect, and this will be done through our Global Pharmaceutical Observatory, again with a regional roadmap for priority areas. National transformation programs, which we've really spoken about in the lens of practice, science and education today, will build on what has worked for the FIP Workforce Transformation Programme to provide a pathway for needs assessment, ways of prioritising and implementing your action plans tailored for each of your countries or institutions. But some further key issues that I wanted to pull together, which we will make sure are really emphasised in the collection and then in the commitments. We wanted to say again, building on what Dominique said right at the very start, see FIP as a platform to showcase, to share and provide a link between our members, our national organisations, the science organisations and our academic institutions. We are producing the FIP seal, which will be a visible sign of assured quality for providers of services, expertise, education and training. We will provide toolkits for priorities and needs assessments so that everyone can identify what is the number one or the number two thing that they need to focus on. And we can provide matching and mapping exercises and guidance and toolkits to aid that transformation. I note earlier we had a question on what is the quality assurance of processes of vaccinations for FIP members, but you will have heard in the reflections on education and workforce development, the need for us to pull together standards and good practice from all our member organisations. So FIP wouldn't be setting standards, but we would be compiling the best practice that we see across our countries that shows the quality assurance needed to develop vaccinations, vaccinators in our societies. I'd urge you all to watch the launch event of the FIP Development Goals, and if not, then maybe the video, which I know will be put up in the chat box as I speak now. So now, this is all about alignment, colleagues. We saw that 17 of the 21 FIP Development Goals are linked to vaccination. We've made that really clear. And also, many of these development goals will be linked to all of our programs as you progress. I know, Dominique, you will have some reflections which you want to share with our colleagues today. And also, based on what you've seen and heard over the past weeks since World Pharmacist Day around alignment, consolidation and delivery. Dominique, I hand over to you for your reflections before I set the scene for Series 2.
Thank you very much. Due to the time, I will not be very long, but I wanted to say that we have committed to delivering in this first series to identify transformation needs across practice, science, and workforce education. And we have delivered this. What you heard is the summary, and thank you very much for this very useful information. Now it's time for pharmacy to deliver vaccination, and you will have to work because the member organization are decided about plan, about needs, and what you can be sure is that FIP will support you. We heard we will have a lot of barriers on our journey. I know how hard it is to implement vaccination because I did it in Switzerland. It took me 8 years, but being member of FIP and having this added value from FIP, you will be quicker because in FIP we have structures, we have a lot of expertise and competence that we can share with you, and we can support you to be a little bit quicker. And please, to Young Pharmacies Group and IPSF, we will not forget you because you are the future of the pharmacy. You are the future of the profession, and it's really important that you will be involved in our strategy. What I want to tell you is, if you doubt about the success of implementing vaccination in your country, think a little bit on this story. That country where everybody thought it was impossible to do something, and suddenly somebody came who didn't know that it was impossible and just did it. So be the one who acts, be the one who did it, be convinced, and you can be sure that FIP will be with you, and this is your added value being member of FIP in trust, solidarity, and actions. Thank you very much. At the end, I just have to thank first all our panelists and speakers. Secondly, I want to thank everybody who was involved in the organization and of this series of sessions, especially Lina and Farah, and all the people for the technical issues in FIP headquarters under the lead of our CEO, Catherine Dagan, Mila, and all the team for communication too. And what I want also to thank is all the attendees during all the these episodes that we had in the first series. I hope that the second one, the third one, will be as well attended as the first one. And last but not the least, I want to thank our sponsors, our sponsor Pfizer. Without the financial support of this company, will not have been possible to organize this session. So thank you very much to everybody involved, also our volunteers, because FIP without our volunteers will not be able to provide this successful content, which are very useful for our members, member organizations, and pharmacists all over the world. I'm very proud to be your president, because when I see the quality of the conferences we had and the quality of the information, I don't think that many federations are able to bring this kind of information. Thank you very much, and back to you, Sidi.
Thank you so much, Dominique. Thank you for your inspiring words and your thanks as well. I agree. We're truly blessed to work with our federation and all the volunteers. It's a great place to be. So to set the scene, colleagues, I realise that we're overrunning, but it's really important that I set the scene for Series 2. We will be deconstructing those development goals that I raised earlier on. We'll be discussing the mechanisms and drivers to progress the most relevant of those goals in the context of transforming vaccination. Please register for these events on transforming vaccination at FIP.org. And this slide, Series 2, really sets out the goals and the main outcome of Season 2. The next slide shows you a schedule of events from next week through to November. Next slide shows you subsequent events. And Series 2 will culminate in an event much like today, where we will be summarising all of the issues that have emerged and drawing from the findings some of those priorities that we have heard from today's session. So we're building as we go, colleagues, layer by layer. Next slide. So please join our next event on the 21st of October. This day next week at 2 p.m. Central European Summertime, which is the first event in Series 2. This is vaccination from specialist practice to everyday practice. And I think this feeds really, really well into some of the discussions that we've had today from a practice and workforce development element. It's an interview format that focuses on the FIP Development Goal number 4. From the perspective of pharmacists who are vaccinators. We discuss the process required to take vaccination by pharmacists from a specialised field that very few pharmacists deliver in some jurisdictions to a general part of pharmacist roles. And we urge you to register for that event. We also urge you to go back and have a little look at some of the previous events in this programme and in our wider vaccination programmes as well. So, final slide, colleagues. I would like to sincerely thank you all for attending today and urge you all to have a little look at some of the previous sessions, as I've mentioned. All of these link back to our World Pharmacy Week, to our FIP Virtual, and to our wider vaccination programmes. Thanks again to our panellists for their hard work, Emma, Paul, Ross, Giovanni, Ralph and Ian. Thanks so much, Dominique, for your reflections at the start, opening remarks and your final comments there. I love it that we shouldn't view anything as impossible. Thanks to the FIP team who's worked so hard on design and development of this series, to Lena, Farah, Carlene and Gonzalo, to Mila and Carola and the events team for events management, thank you. The recording of this episode will be made available on our website, and please give us your feedback on what has worked for you. Really, seriously, colleagues, thank you so much for your attendance and for the chat box, and we look forward to seeing you again for Series 2 next week. Thanks a million. Over and out.